Hello everyone and welcome to this audio podcast. Excuse me, this audio podcast as part of a Meteor edition. This audio podcast as part of a Labostix Meteor. This audio podcast as part of a Biome Bullet. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production. In this audio podcast, an abstract in regard to works that have been works or abstracts that have been put forward to the international pediatric International Pediatric Transplant Association, or IPTA 2022, and the abstract looks at a transplant in neuroimmunobiology and the immune system, transplant rejection, and neuroendocrinology as a sort of looks at this works as a sort of a retrospective. The original works, listeners, was formed in around 2000 between 2004 2006, and the an abstract had been put forward, as said, as mentioned, in for the International Pediatric Transplant Association, or IPTA, in 2022. This collaborative works was where the abstract was between collaborators within around two or three academic institutions, and the abstract is as thus. So leukocyte and lymphocyte migration, or trafficking from peripheral blood into affected tissues, is an essential component of the inflammatory reaction to virtually all forms of injury, and is an important factor in the development of many diseases. Advances have highlighted the central role of chemokines, and cellular adhesion molecules have also been important in allograft rejection, since these molecules allow for protein or receptor binding. In around the aims and objectives, so the aims here were to highlight how specific immunobiological and neuroendocrine markers can reduce chemokine migration and acute allograft rejection, or AAR. In regard to sort of the mechanisms of the pre-transplant phase, or pre-transplantation phase, is just as central as a post-transplant and post-transplant sort of period and neuroendocrine neurocrine and the it has been postulated that Hansen's general adaptation syndrome from 1936 and specific neuroendocrines should be considered surrounding allograft prognoses. In regard to the literature, this works sought to interrogate literature surrounding immunobiology and neuroimmunobiology to better understand acute allograft rejection, or AAR, and post-transplant. Around the analyses, the investigations uniting immunobiology and neuroimmunobiology and acute allograft rejection, or AAR, are still rare. In regard to the conclusions, based on Sany's works, it is postulated that chemokines appear to be integral players between immunobiology and neuroimmunobiology, and using a multidisciplinary laboratory practice should encourage understanding of acute allograft rejection. So now, in regard to some of the terminologies that can be utilized to identify similar works in amongst the literature, include physiology, chemokines, endocrinology, immunobiology, and chronic kidney disease. that draws this audio podcast to a close. This audio podcast as part of a Meteor edition. This audio podcast as part of a Labostix Meteor. This audio podcast as part of a Biome Bullet. And this audio podcast as part of the abstracts. This audio podcast as part of a Storm Labostix production.